Thank you, Beth. Good afternoon, everybody. So, hi, my name is Jeannie. I'm the nurse manager in the Cath lab, and I will be talking about enhancing patient experience in a high-volume Cath lab. I have no relevant financial relationships to disclose. So this is a plaque that Beth had mentioned early this morning. This is our patient experience mission, where you're the heart of the matter. In the Cath lab, we take this statement very seriously, and our number one priority is to optimize patient experience, safety, and quality. As one can imagine, coming for any procedure in a hospital can be very daunting and, of course, very stressful. Patients have all sorts of questions, and of course, the most stressful part is just the not knowing. Last year, we were awarded the Silver Level Beacon Award for excellence from the American Association for Critical Care Nurses. The Beacon Award recognizes an effective approach to nursing, policies, procedures, and processes that includes engagement of staff and key stakeholders. This award demonstrates our commitment to patients, families, to always provide evidence-based and patient-centered care. On the right, you see a picture of one of our nurses, Heidi. She is receiving the Daisy Award with Beth and our director, Heidi, as well. The Daisy Award is given to the nurse who has demonstrated extraordinary, compassionate, skillful care. Heidi was nominated by the wife of a patient who stated, "Following my husband's ablation, Heidi assisted him throughout the afternoon with spirit and spunk. Her uplifting and supportive approach simplified a challenging recovery. Heidi focused on every important detail, especially when my husband tried to walk and felt faint. With professionalism and tender loving care, Heidi opened up space for healing because she was taking care of all the details." We've all heard of HAA caps, but that's more for inpatients. Procedural areas like the Cath lab have the OAS caps. OAS caps stands for Outpatient and Ambulatory Surgery Survey Consumer Assessment of Health Care Providers and Systems. That's just a mouthful. Patients are provided a survey to take once they have been discharged home and are asked to rate their experiences. There are questions about the facility. Was it clean? And would you recommend it? Communications items such as were instructions provided prior to the procedure? Was the procedural information easy to understand? Questions on how staff were treated you. How was your discharge experience? And these are just some of the questions asked. As you can see here, we're comparing 2021 and 2022. And you can see that most of these percentages have increased, which is good. We always want to keep improving ourselves. Here is an example of what our actual OAS caps look like. It appears we do a wonderful job in discharging our patients, scoring over 95%. But comparatively here, it seems we can improve on our communication. Areas for improvement that was listed in here are anesthesia side effects are easy to understand, and information shared on how the procedure went. Both are in the 70 percentile ranges. In order to provide the best care for our patients, we need to ensure that we are always reflecting back onto ourselves. There is always room for improvement. Our nurses are currently working on our pre-procedural communications in order to improve our communications with our patients. Some of our patients may receive instructions from clinics, and then we call them and we provide them slightly different instructions. This causes communications with our patients, and we acknowledge that, and that's why we are working on that currently. Next, I will be discussing the ways we focus on our patients in order to provide the best care. As mentioned, we are patient-centered. We understand that what is routine for us is very stressful for our patients. Some of the ways we reduce the stress is by being focused on our patients. First and foremost, patient communications and setting expectations. Our pre-procedural nurse calls the patient and provides them with directions to the registration area, as well as instructions for the procedure. As some of you may know, wayfinding at the Mount Sinai Hospital can be very difficult because it is so large. We are a very busy lab, seeing up to 70 patients a day. There is constant movement, and patients may not understand why This one person was moved before them. Frequent routing by our liaisons, our nurses, to update the patients on any delays that may occur, especially when we have an emergency situation. So there's no fear of being forgotten. We are mindful that while patients may be sedated, they are still awake, taking care of the patient so that they know what's happening. We have patient liaisons in our Cath lab. They are one of our most vital staff members. They are our point of contact for our patients and families. This is Gidget. She is one of our 3 patient liaisons. Gidget creates a relationship with the family and patient as soon as they have been registered. An exchange in phone numbers is done so that if there are any questions, she can easily be reached. On the short walk from registration area to the ambulatory area, Gidget engages in conversation with the patient and family. This is an impromptu picture that I just happened to take, showing Gidget assisting the patient by carrying their bag. Since 2020, our patient liaisons have been invaluable in keeping our patients and their family members informed on their procedure, especially when visitors were not allowed in the hospital due to the pandemic. As one can imagine, a patient who has just finished their Cath procedure may not remember the conversations about their procedure, or even their discharge instructions, mainly due because of stress and sedation. Our liaisons will ensure that the family member assigned to the patient is always notified when the procedure is finished, and they are always given the option to speak with the proceduralist. Now the patients are allowed back in the hospitals. Our nurses are there to ensure that any member of the family waiting in the waiting room is notified as soon as possible when the procedure has been completed, and allow a brief visitation with the patient. Patient comfort is always a priority for us as well. We have warm blankets, snack boxes, TVs, and tablets always available for our patients. We have close collaboration with environmental services to maintain a clean and therapeutic environment. We cannot assume that the patient is comfortable. Every team member, PCA, nurses, fellows, liaisons, even the housekeeping staff, are all involved in ensuring that the patient is comfortable. An essential component of creating a positive patient experience is through communication. Communication promotes patient safety and provides reassurance on every step of the way. Patient experience does not stop when a patient is not in the lab. It continues in the inpatient units and at discharge. We are in constant communication with many different teams. We have group chats with our various inpatient units, so we can provide up-to-date information to our patients as well as add-on cases. This helps patients know if they can have breakfast or lunch, and allows them to communicate visitation times to their families as well. We are also in constant communication with our housekeeping departments so that we can ensure our inpatient beds, especially, and also our outpatient areas, are cleaned in a timely fashion. For patient discharge from the lab, instructions are given both to family members and the patient to ensure that there's always somebody available who fully understands the instructions. A written copy of these instructions is also given to them so that they may review them and refer back to them once they are at home. When a patient has been discharged, a nurse calls them the day after discharge to check on them. Were they able to get their medications? Did they have any questions that they forgot to ask? Were there any issues? If there were issues, a nurse will escalate to the nurse practitioner who will attempt to solve the issue for the patient. Our nurses help to continue the positive experience for our patients by discussing the plan of care and what to expect in the inpatient units. The recovery room nurse introduces the inpatient nurse who will be taking over from their care. When transferring a patient to the inpatient unit, the nurse maintains face-to-face contact to encourage dialogue to take place. Once on the inpatient unit, bedside handoff between recovery nurse and the inpatient nurse occurs, and the nurse is able to participate in this process and allows them to ask questions. Later on, Alina will speak more about this process. Teamwork is at the foundation of our care. When a team works seamlessly together, the team as a whole will get recognized and thanked. Today, I just happened to stop by the mailroom, and I received a thank you card from one of our patients, and I would like to share some of the comments that she had made. First off, she said, "Thank you, thank you, thank you. From start to finish, every person I encountered was professional and hardworking. You were all incredibly kind. I could see how busy you were, but never too busy to help whenever you could. Thank you for that. I know from my own RN days how much gets thrown at you in a shift. I wish that I could thank you by name, but please know that my family and I hold each of you in the highest regard. Thank you. So finally, the take-home message that I'm trying to say is that patient experience is a team effort. Every single one of us is responsible to ensure that the patient feels cared for. Thank you.